I tried to hide it. I tried to put on a happy face, like everything was okay. But my depression followed me everywhere I went. It robbed me of my energy. It left me feeling hopeless and anxious. It seemed like no matter what I did, I couldn't help but feel this overwhelming sadness, like a glass half empty. Even when I was taking antidepressants, I still struggled. But that's when I talked to my doctor, and he recommended Sanquilaphal.
Sanquilaphal is a revolutionary new drug that has been proven to treat depression right at the source. It is thought to work by identifying all the sadness molecules in your brain and beats the shit out of them, forcing your sadness to hide away in the depths of your mind. With normal antidepressants, you'll only get partial results. But with Sanquilaphal, you won't need to use any other drugs. Sanquilaphal is the only drug you will need to feel whole again. Talk to your doctor and see if Sanquilaphal is right for you.
Sanquilaphal can cause serious side effects. Do not take Sanquilaphal if you are pregnant or may become pregnant. Taking Sanquilaphal while pregnant could lead to premature birth, stillborns, or children with extra fingers and/or limbs. Tell your doctor if you start having periods multiple times a month, as this could lead to premature menopause and in some cases infertility. Only take Sanquilaphal after eating a meal. If not taken properly, this can lead to toothaches, dry mouth, dry eyes, dry pits, dry balls, dry ass, upset stomach, loss of appetite, taste, smell, hearing, changes in metabolism, taste, and could lead to allergic reactions. Signs of allergic reactions involve but are not limited to rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing, talking, unusual hoarseness or swelling of the mouth, face, lips, tongue, or throat. Other side effects include issues with sleep, including insomnia, nocturnal emissions, night terrors, and extreme bedwetting. If you experience bedwetting at a higher than normal rate, remember to hydrate, as extreme bedwetting could lead to dehydration. Women have frequently reported increased hair growth on the back, chest, and face. High usage of Sanquilaphal has had frequent results in extreme hormonal changes, leading to baldness, hair growing in places where it shouldn't, penile growth or shrinkage, testicle swelling, and/or melanoma on the scrotum. Sanquilaphal is not intended for gender transition hormone therapy and is not recommended for use if you are transitioning. In rare cases, some patients have experienced severe constipation leading to hospitalization. If you release a stool longer than 3 feet, lower your Sanquilaphal intake to a safer dosage. If you release a stool longer than 5 feet, call 911. If you are a user that spends a lot of time outdoors, you could be at risk for other negative symptoms, including severe allergies, light sensitivity, loss of balance, dizziness, confusion, easy bruising, and profuse sweating of a foul odor. In some cases, patients have experienced minor and extreme memory loss. If you experience memory loss of any kind, remember to talk to your doctor. Please refrain from doing any physical activity while using Sanquilaphal. Engaging in physical activity while using Sanquilaphal can result in increased blood pressure, tinnitus, migraines, numbness, nosebleeds, loss of hearing, vision, and fainting. Many patients have experienced edema, rapid and fluttering heartbeats, right-sided heart failure, left-sided heart failure, congestive heart failure, and multiple clots in the arteries. If your heart suddenly stops beating or you lose complete consciousness, call 911, as this could be a sign of a heart attack or stroke. Do not use Sanquilaphal if you are currently using weight loss medication, as this could lead to sleepwalking and eating, leading to increased weight gain. In rare cases, some patients have reported sleep paralysis followed by hallucinations. Some patients have reported hearing messages from the underworld and threats against their families by the shadows. If you develop an unnatural fear of the dark, studies have shown investing in a flashlight or a night lamp have been proven to decrease anxiety. If you start to experience hallucinations in your day-to-day life, please lower your dosage to a healthier level. Other side effects include narcolepsy, sudden onset of diabetes, weakened immune system, decreased white blood cell count, myocarditis, muscle weakness, and joint stiffness. If you're having a hard time keeping food down and have experienced frequent uncontrolled projectile vomiting, consult with your doctor immediately, as this could be a sign of rare but permanent conditions. Don't use Sanquilaphal with any nausea medications, as this could lead to even more side effects. Other common side effects include raging erections. If you experience an erection lasting more than 4 hours, or if your scrotum swells up to the size of a cantaloupe, consult with your doctor immediately, as this could lead to permanent negative conditions. Some patients also reported experiencing uncontrolled flatulence. If your flatulence hint of a smell of death, trust your nose and talk to your doctor immediately. On rare occasions, some patients have experienced seizures. If you start experiencing seizures, consult with your doctor about adding seizure medications to your list of meds. Missing your daily dose of Sanquilaphal has proven to lead to further side effects. If you experience uncontrolled muscle spasms, consult with your doctor, as this could be a sign of a life-threatening condition and can become permanent. Never stop taking Sanquilaphal cold turkey, as this could lead to permanent negative results, including permanent brain damage, coma, or death. Users of Sanquilaphal have frequently reported increased levels of sadness, suicidal tendencies, and homicidal ideations. If you experienced uncontrolled mania, violent outbursts, uncontrolled screaming, or bruised fingers, talk to your doctor immediately. If you or somebody close to you unexplainably wake up in a ditch with no memory of how you got there and no knowledge of what state you may be in, stop taking Sanquilaphal immediately.
I used to have really bad depression, but now I feel great.
Sanquilaphal, take control of your sadness.